Thank you for joining us for our virtual open enrollment fair session. At this time, we will go over UnitedHealthcare medical benefits for plan year 2024. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. And if you have a question, please type it in the chat box located on the right-hand side of the presentation screen. Be informed that if you do type a question in that chat box, everyone attending the session will see your question and your name. So if you have a question that is sensitive or confidential in nature, we recommend that you reach out to the County Benefits Division or your department benefits ambassador who can assist with answering any questions that you have. Lastly, today's webinar is being recorded and a copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Matt Ogden.
Good morning, everybody. Thank you so much. Thank you, Nidra. As Nidra had mentioned, my name is Matt Ogden. I am an account manager with the California Schools VIBA and your dedicated account manager for the County of San Diego. So we have a lot to go over today. So for today's agenda, we're going to talk a little bit about the UnitedHealthcare product review. So that's going to include the HMO plans that are going to be offered to you. And then we're going to go into the UMR product review. This is the PPO plan that's offered to you. And then your pharmacy benefit manager is through Express Scripts. So we have a presentation from Express Scripts, and then I'll be discussing your additional benefits as well as your VIBA contact and support resources. As Nidra mentioned, we will be answering questions. So if you do have any of those questions, please feel free to type them into the chat feature. With that being said, let's go ahead and get started. We're going to talk about the UnitedHealthcare product overview, and so I will turn it over to Nick Cruz.
All right, thank you, Matt, and good morning, everyone. Hope you're doing well. My name is Nicholas Cruz, and I'll have the privilege to go over all of the wonderful UnitedHealthcare benefits with you today. All right, so jumping right into the next slide. As always, UnitedHealthcare likes to provide some of the reminders about requirements of being enrolled on an HMO plan. One of those is just a reminder that you must choose an in-network primary care physician from any of the participating medical groups on the plan network that you select. Plan selections are required at the time of enrollment and are locked in once you make them. Members are enrolled with the family are able to select different medical groups within the same network that you select. So as an example, let's say the subscriber selects UCSD and a spouse or a dependent selects a primary care physician within Scripps Clinic. This is allowed because both of those doctors or medical groups are within the Alliance network if you are enrolling on the Alliance network. And the same goes for each of the other networks as well. Again, as long as the given primary care physician or medical group are within the network that you select, you can have varying medical groups. Medical group changes within the plan network are also allowed, meaning that you can change your primary care physician or medical group at any time. It just follows a rule known as the 15-30-day rule, which basically means that you're going to want to call in before the 15th of the month in order to request that change to our member services team. And when you call in before the 15th of the month, that change is effective the first of the following month. Now, if you call in after the 15th of the month, that change is not effective the first of the month following the month right after, but it's basically a month and a half out that change will go into effect. So you'll want to, again, be sure that you're calling before the 15th of the month so that change goes into effect as soon as possible. And that way there's no delay with making appointments with your new physician that you select. Now, again, there are some exceptions for that, so you always want to call in and discuss that, but that is the rule that you want to keep in mind when making those changes. All right, and as always, UHC does support qualifying life event changes for adding dependents or anything, changes that come up, such as loss of coverage or newborn dependents, marriage, things of that nature. All right. Perfect. So here we have an overview of the first plan offered by the county, which is the Performance HMO Network 1 plan. So the good news on this plan, for those already familiar with the plan, there are no changes for the 2024 plan year. Copays will remain the same for the year. Your PCP and specialist copays will be that $25 copay. Urgent cares will also be a $25 copay. ER visits have a $125 copay, and if you're admitted to the hospital, your copay is $200. Now, there is no deductible or on this plan, and the out-of-pocket maximum is $2,000 for an individual and $6,000 for the family. Now, if you look to the right of the screen, you'll see a list of all of the available medical groups within the plan, such as Optum, Radies, the varying Sharp medical groups will also be there, like Sharp Community, Sharp, the Arch Health Partners will also be there, Sharp Reese-Daily. So you'll find all of the varying Sharp medical groups there as well. Next slide. Perfect. So here we have an overview of the Alliance plan. So again, here there will be no plan changes for 2024 on the Alliance plan. All of the copays will remain the same. Your primary care physician copay will be $25. A specialist copay will be $40. Urgent cares will be that $25 copay as well, whether it's in network or out of network. ER visits will be $125 copay. And if you are admitted into the hospital, your copay is $200. Now, on this plan, again, there is no deductible. The out-of-pocket maximum will be that $2,000 amount and $6,000 for the family. Now, again, on the right is the medical groups offered under the Alliance. Alliance is more for members looking to elect their Scripps primary care physicians. It's more of a Scripps centric. You'll see that there's Scripps Coastal, Scripps Clinic, Scripps Physicians, as well as Mercy Physicians medical groups, which is a Scripps Care affiliate within the network. UCSD is also available, but again, you see here that Scripps is available and Sharp is not. So just a bit of the difference to call out if you're looking for specific primary care physicians when making your plan selections this year. Next slide. Perfect. So the next slide we have here is the Harmony Network High Deductible Health Plan. So this plan is an HSA compatible plan, which has combined medical and RX accumulators. So to clarify that, the combined accumulators basically means that the RX copays from Express Scripts will be included in the medical deductible and out-of-pocket maximum on the medical plan. So there will be two versions of this plan. The first version will be for individuals only who are basically enrolling on the plan with no dependents. The individual only will have a $2,700 deductible, and the out-of-pocket limit will be $3,200. Now, for members enrolling with a family, this will apply to members enrolling with one or more dependents. This plan will have a $3,200 deductible, and the family, again, the family side will have a $3,200 individual out-of-pocket maximum and a $6,000 out-of-pocket maximum for, again, this is for the family. So on this plan, for those who aren't as familiar with the deductible and out-of-pocket limits and what they mean, a deductible is the amount a member is responsible to pay for medical services prior to the plan or UHC paying on claims. The out-of-pocket limit is the maximum amount a member will pay in a calendar year. And once you reach or pay that full out-of-pocket limit, UHC will cover all claims and services at 100%. So as you can see on the grid there, there is for the plan benefits. It gives a breakdown again of the copays that you'll have. Here you'll have for primary care physician and ER, your 10% copayment after the deductible is met, which basically means that members are responsible to pay in full for services until you satisfy the deductible on the plan. Now, once the deductible is met, you will only be responsible again for 10% of the allowed charges for the service. So again, those are just a bit of the differences. On the other two plans, you have a flat copay. These you will have your deductible responsible for, and then the co-insurance until you reach your out-of-pocket maximum. On the right, you'll see a list of the available medical groups within the Harmony Network. Here you'll see that Sharp medical groups are within the Harmony Network, as well as UCSD and the Optum Care as well. So those are just some of the facilities and the varying medical groups that you'll find within Sharp if you're looking to enroll, within Harmony if you're looking to enroll on the Harmony plan. All right, next slide, please. So the next slide will give you basically just a kind of a side-by-side comparison of of the three plans that are offered, and just so you can see a bit of the differences between the copays and what you'll pay for the general services that you have when you go to the doctor's office. Again, if you look at primary care physician specifically, again, $25 for both the Alliance and Network One plan. But when it comes to the Harmony High Deductible, you have that 10% copayment after you reach your deductible in full. So for the most part, majority of that is the same across the board. The only one that is different that I would call out is on specialist. Again, for the Network One, you have a $25 copay. Alliance is the $40 copay, and the Harmony plan has that 10% copayment after deductible again. So again, just kind of a high-level overview of to give you a snapshot to compare when making decisions. Preventative care. So this is just a reminder that on all plans UnitedHealthcare offers, all of the plans, preventative care is 100% covered. Even on the Harmony High Deductible plan, where there is that deductible on the plan, this preventative care is 100% covered. There will be no copays. There will be no deductible applied for preventative care on any of the plans. So again, this is for all of services like immunizations, preventative vaccines, exams, health screenings, your annual physical, visiting an OBGYN, various screenings throughout. All of those preventative coverage will be covered at 100%. So we highly recommend all members take advantage and speak with their primary care physician about these benefits because they're offered again and covered 100%. All right, so jumping right in here to the next slide, we'll have the County of San Diego, the dedicated member website. This site is the yuhc.com/COSD. Now on this site, there's no email, username, or password required to enter into the site. It's available for existing members and potential members. You can view and download, you can view plan options, find providers, hospitals, urgent care, ERs, and you can also view a variety of the wellness benefit information available to our members once you sign up on a UHC plan. Now this site provides access to the provider search tool. This tool is broken down by each of those individual networks that we went over before. So it makes it really simple for you to just simply select the network that you're looking to enroll onto. And then once you go to the provider search area, you simply put in, a zip code. You can put in a name of a specific provider or an address if you're just looking for within, an area within the address from your home or work. Any of those. So it really makes it simple for you, and just one click and you're already in the area to search for those doctors. So we highly recommend when you're making those decisions or just selecting a primary care physician to utilize this site to make it as easy as possible for you. Next slide. Oh, there we go. Transferring to new medical groups. So we at UnitedHealthcare understand that When it comes to selecting insurance or making a decision during open enrollment, whether it be moving to a new medical group or whether it be moving to a new insurance, maybe you're thinking about making a change from one insurance carrier to another. There are some decisions and things to take into consideration when making those changes, and it can be difficult at times. Thinking about things like selecting a primary care physician, you're not sure who to select, scheduling that first primary care physician appointment, transferring medical records, prescriptions, any of those questions or issues that you may have that you're just not sure on, and you need some help making those decisions. We're here to help. So what we've done is we reached out to all of the varying medical groups in the San Diego area and, got answers to all of these questions to make it easier for you. And we basically provided all of that information to the contact points that you would reach out to, including the VIBA advocacy team, which are an amazing group of individuals, and they have all of this information available and ready to help you. And again, this is including our member services team, who will have all of this information as well, and will be able to assist and walk you through this process, when you're making these changes. So we highly recommend, if you're an individual who's looking to make a change this year, to reach out to those teams to get that assistance, because they're waiting to help you out. ID cards. So ID cards provide all of the information necessary with syncing medical services, such as your member ID and group numbers, your assigned primary care physician and primary medical group, as well as any general copays that you'll have for the year. And then, if you have a deductible or an out-of-pocket maximum on your plan, that will also be listed on your card as well. Now, the back of your card houses all of the general contact points members can utilize for assistance, including the dedicated customer service number, which is that 888-586-6365. And again, this is that number that I just mentioned that you can reach out to if you have any questions at the member services team for UnitedHealthcare. The number for the mental health support line will also be listed on the back of the card, and the provider support number as well. On the back of the card, you'll also find the claims address, just in case you have any questions or issues come up where you need to send in a claim for whatever reason. That will be on the back of the card as well. Now, just a reminder that anytime there's a change to any of the information listed on your ID card, a new one will be generated and sent out within 7 to 10 business days of that change. So again, whenever you make those changes, you'll want to be sure that you throw out the old card, so that way that you don't have any conflicting information. Or let's say you go to the doctors and it's old information, and for some reason, your primary care physician's wrong, or there's a wrong copay on there, whatever it may be. You just want to avoid those issues. So throw out that old card, and once you receive the new card, make sure that's the one that you're giving. Next slide. So the next slide we have goes over the myuhc.com website, which is the UnitedHealthcare member portal. On this site, you can view things like claims, bills, referral status. You can search our networks, providers as well. You can also access the Raleigh portal, things like virtual visits, and you can also print temporary ID cards as well on there. Now, if you are a UHC member and have not registered, all you need to do is have your insurance card handy and go to the myuhc.com website and register and create a profile. The ID card has all of the relevant information that you need in order to register, so that's why we recommend having it in hand. If you don't have it in hand, you can still register with some additional information that you'll have to input in, but it's still simple and easy. There is also a UHC app available that you can download directly to your phone. Again, it's just My UHC that you can type in when you're looking for the app. And it has all of the same access and information available through the online portal is available through the app too. So all of those same wonderful functions. One great thing that I like to add when it comes to the app itself is, if you're like me and like to lose your ID cards, there is a digital ID card available through the app. So whenever you pull up your phone, log into the app. There's a card there that you can show right at the doctor's office. And that actual digital ID card is available within 48 hours of a change being made. So it's if you do make a change and you need to go to the doctor's office, you don't have to wait around for your card to come in the mail. You can simply pull up that app. So it makes things a little bit easier sometimes. So again, it's something that I recommend for members all to register for, just in case it comes, you need it in a pinch. So again, definitely a resource for you to have. The next slide here goes over virtual visits. So we mentioned just a bit ago.
Oh, we might have lost Nick there.
I believe we have. Give it a couple more minutes. He'll hopefully be
Yeah,
back on.
I was going to say what I can do is I can go over this slide for you guys. So virtual visits is really popular now for any members that are seeking services, 24/7. Basically, if you guys have any non-emergency related issues and you would like to, speak to a doctor, then virtual visits is a great way to go. And you can reach out to them for any non-emergency related issues. These include like allergies, eye infections, bronchitis, rashes, more. I know I used them a couple weeks ago. Unfortunately, I had tested positive for COVID. It was over the weekend, and basically I was able to go ahead and get a virtual visit at no cost. So if you enroll into any of the UnitedHealthcare HMO plans, then as long as you use one of these 4 designated providers shown over to the lower right-hand side, then basically virtual visits will be at no cost to you. So that's Optum, Teladoc, Amwell, and Doctor on Demand. If you do need to go to the emergency room, we always suggest that you do go to the nearest emergency room. However, this is a great way where you can go ahead, see a doctor. Maybe you have dependent children, they've got a sore throat, or they're not feeling well, or maybe the flu. You can reach out to one of these providers, have a virtual visit. They can even prescribe you prescriptions, so they can go ahead and send that over to your local pharmacy as well. So really great to get immediate care. They have wait times as little as 5 minutes. And so you can always just go to uhc.com/virtual visits or the uhc.com website, and then you can go ahead and schedule any virtual visits that you would like. Do we have Nick that's on was he back?
I don't see that he was able to get back on as of yet.
Okay. Nick?
There he is.
My power went out of the house. So I'm now on my phone. But I'm not sure if you jumped in, Matt, but I can continue on from here if you'd like.
Yeah, no, that would be great, Nick. So basically, I did speak on virtual visits, so we're on to the Able2 app.
Perfect. All right. Sorry about that, everyone. So Able2 is the new virtual behavioral coaching app that's available through UnitedHealthcare. So this app is for managing things like stress, anxiety, and depression, and basically have dedicated one-on-one weekly sessions with the coach therapist. These sessions do go on for 8 weeks. And, the great thing about the program is it allows you to have in-app messaging in between those sessions with your provider as well, or the therapist or coach that you're working with. So it's definitely a great program, new, and these coaches have a minimum of 3+ years experience. It works based on a therapy known as cognitive behavioral therapy, and these are the techniques delivered, and the progressive models that they utilize for this program. So it's definitely a great program. Highly recommend utilizing it. If you'd like more information, you can simply go to the able2.com website. There's also a QR link there available and it'll take you directly to the website. All right. So in the next program, the next slide, we'll go over OnePass. So OnePass is our exciting gym membership program, and this is a subscription-based program where basically there's a fitness network of gyms and studios that are available to members. And OnePass offers basically what we call freedom of choice between 4 different tier options that are available. So those tier options are Total Fitness, Universal, Premium, and Ultra Fitness. Each tier ranges in price beginning at $25 a month up to $139 a month, which are all, again, there's 0 enrollment fees required for this. And each tier offers multi-location access where you have, again, that freedom of choice to change locations at any time and the ability to access all of the amenities that are available within each gym that what each gym offers. So, if you're someone who enjoys all of the classes that the gym offers, and let's say that there's limited availability, or, you simply run out of classes at one gym. The great thing about it is, you can hop over to another available gym within the tier that you select and still take up all of those wonderful classes. So, again, definitely something to look if you have a membership just to see where your gym lies and open up, your possibilities. So again, wonderful program, and that's OnePass. The next one we have here is the chiropractic and acupuncture services. Chiropractic and acupuncture services will be available to all VIBA and UnitedHealthcare members. This coverage is offered through Optum Health, and it will include unlimited visits, but the visits are subject to medical necessity, and your copay will match similar to your primary care physician visit on your elected plan. Now, if you're looking for a provider for chiro or acupuncture, you want to make sure that you go to the specific website listed there. It's at My Optum Health Physical Health of CA.com. This is where you'll find all of the in-network chiropractors and acupuncturists. You want to make sure, again, that you go here, because if you go to the all other site that we went over today, you may not be able to find all of those doctors. This is the specific site, again, that you'll want to find all of those in-network doctors. Now, one point I would like to call out is when you are searching, there's a section that says plan product. In this section, you're going to want to make sure you put in California Schools VIBA in the dropdown, because that will make sure that you get the correct listing of in-network doctors for chiropractic and acupuncture services when you're looking for them. Okay, so again, California Schools VIBA from the dropdown. You won't have to input it in; just make sure you find it on the list. All right. So the next slide, again, UnitedHealthcare is always here to help. If you ever have any questions, we have dedicated teams standing by to assist and answer anything you need. So again, it starts with that dedicated VIBA customer service team. It's that 888-586-6365 number. That number is on the back of your ID cards, but just in case you need it now or want to save it in your phone for whatever reason, that number is available. The behavioral health customer service number is that 888-625-4809. Again, that is also on the back of your ID cards, but wanted to make sure you had it available now. There's also the website that we went over where you can find a wealth of information. Is that County of San Diego member site. It's that COSD, and our UHC member website that available to you, myuhc.com. So again, those are all of your customer service contact points available to you that can pretty much answer any and all of the questions that you. All right. Well, thank you very much, John. I apologize for the delay with my my power going out, but I appreciate your time, and I'll go ahead and pass it on over to Matt for the next presenter.
Thank you so much, Nick. Appreciate it. And yes, we do apologize for the technical difficulties. Right now, we're going to go ahead and transition into UMR that's going to discuss your PPO plan offering. So with that, I'm going to go ahead and introduce Rochelle. Rochelle, it's all yours.
Thank you, Matt. Good morning, everyone. My name is Rochelle Rabuco, and I am the UMR dedicated account manager for your group today. And my purpose today is to present you with your PPO benefits, as well as the tools and resources that is available to you with your UMR PPO medical benefits. Next slide. So what is UMR, or who is UMR? So UMR is a third-party benefit administrator. It provides the employers and health benefit plan members with services to help you get the most from your benefit plans. UMR will assist in managing the benefit plans on behalf of California Schools VIBA for the County of San Diego. And our main goal is to provide you and your family with timely, accurate, and caring services. This includes medical claims processing. We also help coordinate care if you are in the hospital or dealing with a chronic care healthcare condition. Next slide. So with UMR, you have access to the PPO network, and the PPO network are providers that are contracted with UnitedHealthcare. They are a group of doctors, hospitals, and other healthcare providers who provides and offer their services at a network at a discount on the services that they provide. A great benefit to you is if you go into if you go to an in-network provider, is cost savings. So when you receive care from an in-network provider, the plan typically pays the bigger share of the cost, and you'll pay less out of your pocket. The great benefit about the UMR PPO is that the freedom of choice. You have the ability to self-refer. If you're enrolled in the PPO plan, you have the flexibility to switch primary care physicians anytime, and you can see a specialist without a referral. And specialist could be anything from a dermatologist, gynecologist, or infectious disease provider. And you are free to choose any provider that you want to see. Next slide, please. Here we have an overview of how your PPO medical plan works. So as you can see, you have to meet your deductible before you have to pay a copay or co-insurance. So for an individual, you're looking at paying at $300, $600 for a family. And the most you can expect to pay out of pocket would be about $2,300 if you're an individual, and $4,600 if you're a family. And the co-insurance for the medical expenses, the plan will pay 80%, and your co-insurance would be 20% if you were to go to a network to an in-network provider. And you do have an out-of-network coverage, and the plan would pay about 60%. And of course, if and when you were to go to do an office visit, if you are seeing a primary care physician, you are looking to pay $20 for a copay per visit. $40 copay per visit if it was a specialist. And as you can see here, you do have pharmacy, and it'll be through Express Scripts, and Amy will be able to talk more about that after our presentation. Let's see, I'm sorry, can you go to the next slide? Here's a continuation of some of the benefits that's available. So should you ever find yourself to do an inpatient hospitalization, you're looking to pay at $150 copay per admission, and it'll be 80% paid by the plan after the deductible. For urgent care, it's $75 copay per visit. Emergency room, $125 copay per visit. And you also have therapy services such as occupational, physical, or speech therapy at only $20 copay per visit. However, there is an annual unlimited visits, but will require medical necessity approval after the 30th visit. And just kind of like UHC, you have preventative care services, screenings, and immunization covered at $0 copay per visit, and the deductible will be waived. And you also have virtual visits through Teladoc at $0 copay per visit. This is a picture of your ID card. We have the front and the back. On the top right is the front cover of your ID card. And on this card, you will be able to see the member ID that's assigned specifically to you to track all your benefits and claims information. It'll also show a list of the family members that are covered under your plan. And then your medical provider network is also referred to as your preferred provider organization, which is on the bottom right. And as you can see, it shows that it is the UnitedHealthcare Select Plus. And then you also have your health group plan number to the top right underneath the logo. And we also have the pharmacy benefits information, which is basically the pharmacists use this to process your claims. And then to the bottom left is the back of your ID card, and it basically shows the network, the in-network and out-of-network deductibles and out-of-pocket maximum amounts on there. And we also have the UMR care management phone number to call if your plan requires to do a prior authorization on certain medical services. And as you can see, we also have the 800 number for your nurse line, Carum Health, Express Scripts, as well as the claims address should you need to submit a claim. And if you are traveling outside of your network coverage, you can look to see if you have access to the regional or secondary network on here. And like I said, you also have the UMR, and first and foremost is you also have the phone numbers for the UMR customer service and nurse line. Next, please. Some of the resources and tools that's available to you. So it's important to remember that you will have access to umr.com website after you have been enrolled. After you receive your member ID card, we suggest that you make umr.com your first stop because you'll find everything that you would want to know and need to do. So it's important that you want to log in and review what's there for you. With access to the UMR website, you can see your benefits information anytime, whether it's on a desktop, a tablet, or even your mobile smartphone device. From the menu tab, you would just be able to check the benefits and highlights of your plan, such as co-payments, co-insurance, for you and your dependents. And you can also see the amount of your office visit. You can review your deductible and out-of-pocket amounts, and if you are close to reaching them. As you can see on the sort of top left, it's basically just showing you how you would go to umr.com and how you can log in or register to sign up. And as you can see, it says here that it's really helpful to have your UMR ID member ID card handy because it will require you some information to be able to set yourself up on the portal. As you can see, spouses and adult children must also create their own online account, and then you must also provide a valid email address. And we highly recommend you use a username and password that you can remember. To the right of the screen is basically the access to personal health information. It was just we're letting you know that if your member, so your spouse or overage dependents or the age, well, 18, they are able to set up their own, they're actually required to set up their own account on the umr.com. But after logging in, they can select the account settings icon from the top of the page, and they can grant access and privileges to the plan holder to be able to view all the information for their claims and benefits. Next slide. Okay, so in here on the website, you will also be able to use the online provider directory. After you become a member, you can easily go into the umr.com, find a provider, and you can select either by the name of the provider, an address, a city. You should be able to select the network. And again, if you're not familiar, it would be the UnitedHealthcare Select Plus network. Or you also have the option of clicking this little white tile with a little person on it. And again, it would take you the same way to be able to find a provider. Along with being able to find a provider, we also give you the option to be able to find mental health provider services in here. And you would also simply click on the little white tile that looks like a person with a brain on it. Or you can also call the UMR toll-free number at 1-800-826-9781 and then ask a representative for help if you're having difficulties trying to find either a provider or in this case, a mental health provider within your area, or if you're traveling and need assistance. Next slide. We also offer, like I said, UMR on the go. It's this way, another way for you to be able to have the information you need at your fingertips. You can get your ID cards, look up in-network healthcare providers, or find out if there's a copay for your upcoming appointment through your mobile app. And kind of like what Nick had mentioned under UHC with Yomar to Go, you can easily forward your ID card to a provider's office, even the morning, the day of your appointment. It's quick, it's handy because like he mentioned, most of us either forget it or lose the cards, but you'll always be able to pull the ID card from your mobile app. And same thing, it would take about, I believe, 7 to 10 days if we were to mail a new ID card out to you, but it'll take only 48 hours for you to be able to access it online. Right. So with the PPO plan, choosing a primary care provider is not mandatory. However, we do highly encourage that you choose a primary care physician. The primary care physician can help manage your prescriptions of medications. When you're also have an established relationship with your PCP, you can ask for advice and information on healthy behaviors, treatment options, and self-care. Even if the plan doesn't require a PCP referral to a specialist, it's always a great idea to check in with your PCP as they can also recommend specialists to you. But again, you have the option of taking their referral, or you can, I have a friend that recommended this provider. Again, with the PPO plan, you have that flexibility to choose a provider. On our website, again, you can also look at ratings to see if this is a provider that you would, fits your comfort level. And again, you can make these changes at any time. We also have certain services that may require some prior authorizations. So to the right is a list of some of the information like hospitalizations or inpatient surgeries. Again, if it's a preventative service, it'll be covered 100%. However, if there are certain things that you would need to do a surgery or inpatient, outpatient, if you need a dialysis or even home health care or behavioral health stays, we just highly recommend that you call the 800 number in the back of your card to see if a prior authorization would be required. Okay. As I mentioned earlier, you do have access to the telehealth through TeleDoc, and this is being able to talk to a doctor anytime, anywhere. You would basically receive the same quality care by a TeleDoc healthcare provider by just connecting my phone, video, or the mobile app. You'll be assisted in 10 minutes on an average call. And again, it's a network of doctors that can treat any member of the family. Yesterday, I mentioned there are some folks that were traveling on vacation with a newborn baby. They had some, they were worried about the baby. So again, they're in a new town or a new city that they were visiting. They didn't really know where the closest urgent care was. So again, this is a great option. You can do it from the comfort of your home, your hotel, and be able to kind of get some assistance. And again, if it was for some non-emergency issues, such as like maybe a cold, a flu, allergy, a rash, sinus problems or pediatric care, it's a great way to be able to save you some time and get the same information. And they would also be able to advise you if it's something that would require you to go to an emergency room or urgent care facility to get treated. Another option that you can also do with the TeleDoc is get specialty care, such as dermatology for like skin conditions and behavioral health therapy. So there are options on the app once you log in that will ask you, are you calling about a general health or dermatology or behavioral? And from that point, it kind of gives you a quick guide through on how to select the appropriate provider. Next slide. Did we move on to the next slide? Sorry. Okay. And I'm not sure if your screen froze, but.
My
Okay.
apologies, Rochelle. I'm
that's
on
okay.
the talking to a nurse anytime, night or day. Is it not showing that on your guys' screens?
Oh, yes. Okay. So now I'm there. Yes. Sorry. Okay. So I'm on, you're correct, Matt. You're on the talk to a nurse anytime, night day. So one of the other services that we offer is what we call our nurse line. You can talk to a nurse anytime, night or day, 24/7, 7 days a week. And again, this is another benefit to you. is that you can call UMR's nurse line service and it will connect you to a team of registered nurses who can answer your questions and provide advice. Our nurses are standing by to help any time of the day, 7 days a week, as I mentioned. And we even have nurses that's available to chat live with you online at umr.com if you're more comfortable with that, or just calling the 800 number that's on the screen, 877-950-5083. They can, like I said, answer questions such as like, what preventative screenings do I need? How can I learn about a new diagnosis? What over-the-counter medicines can help, or should I go to the emergency room? So it's something that is, again, easily, you can do this from the comfort of your home before you have to get up and go somewhere if it was recommended that you do go to a urgent care or an emergency room. And last but not least is, how can you contact UMR? You can call the member services number at the back of your card at 1-800-826-9781. You can call, you can use the chat feature on umr.com, yeah, I mean, those are the two options. You can call us or you can use our umr.com chat feature, and we're standing by to assist. We have what we call our customer first responder representatives that will be able to help direct your questions and answer any other inquiries that you may have. And I think that is the end of my presentation. Thank you so much for your time. If you have any questions, please let us know. Have a great day, and I'm returning to Matt for the next presenter.
Thank you so much, Rochelle. Appreciate it. Now to talk about your prescription benefits, your pharmacy benefit overview, I'm going to turn it over to Amy Williams. Amy, it's all yours.
Great. Thank you, Matt. Hello, everybody. Again, like Matt said, my name's Amy Williams. I'm with Express Scripts. I'm going to take a few more minutes of your time today to talk over your pharmacy benefit overview. All right. Express Scripts manages your prescription benefit on behalf of the County of San Diego and California Schools VIBA. Express Scripts helps patients access affordable prescription drugs safely and efficiently. Each year, as a leading pharmacy benefit manager, Express Scripts saves approximately $32 billion for the nearly 100 million Americans and thousands of clients that we serve. We're here to give you better, simpler ways to manage your medication and your health. Express Scripts is committed to providing you with access to proven medications at an affordable price. The medications on your drug list, also called a formulary, are covered by your prescription plan and are routinely reviewed by an independent panel of physicians and pharmacists to ensure that you receive clinically effective care. The medications on your prescription drug list are known as preferred medications and include both generics and brand name medications. If you fill a prescription for a non-preferred medication, you'll have a higher copayment. Certain medications are excluded from your drug list, which means that they are not covered. In most cases, if you fill a prescription for an excluded medication, you'll have to pay the full cost for that medication. If you're using non-preferred or excluded medications, of course, please talk with your doctor about moving to preferred generics or other preferred brand name alternatives to help you save money. To help you stay healthy, you can receive vaccinations, including the COVID-19 vaccine, covered by your prescription plan at a participating retail pharmacy. Call your local pharmacy to ask your pharmacist which vaccines are right for you, to find out if your pharmacist can administer the recommended vaccinations, and to learn which vaccinations are covered by your plan. And of course, don't forget to present your ID card with the pharmacist. When appropriate, we encourage you to consider taking advantage of generic prescriptions. FDA-approved generic medications contain the same active ingredient as brand name counterparts and are just as effective. Millions of people use generics. In fact, 9 out of 10 prescriptions filled in the US are for generic medications, and generics typically cost much less than the brand name medication. It's also important to note that a generic equivalent contains the same active ingredients as the brand name version, whereas a generic alternative is similar to the brand name medication, but it's not the exact same formulation, such as it might be a different color, shape, or it may have different inert ingredients. Be sure to review your medications regularly with your doctor, and always be sure to ask if there's a generic for that. You can also use one of our digital tools, which I'll touch on in the next couple slides here, the price of medication tool to kind of help you plug in the medication you prescribed, and it will prompt you on other cheaper alternatives or generics that might be available for you to consider. Prior authorization monitors prescription medications to make sure that you're getting a prescription that is suitable for the intended use and covered by your prescription plan. If your pharmacist tells you that a prescription needs a prior authorization, it simply means that more information is needed to see if your plan covers this medication. And only your physician can provide this information and request a prior authorization. This really is important for a few select medications and classes of drugs to help us kind of keep that communication and keep in line with your doctor. So again, to get prior authorization started, please do contact your doctor's office to trigger that request. Drug quantity management verifies that the correct quantity, either tablets or capsules of the medication. It ensures that the most cost-effective product strength is dispensed, and this helps reduce waste. When you're prescribed certain medications that are part of drug quantity management programs, such as maybe opioids or controlled medications, Express Scripts will make sure that you receive the amount or the quantity that is considered safe and effective by the US, the FDA. While new members will receive an ID card in the mail, I wanted to point out that you are also able to access your ID card digitally, just as you've heard from other individuals here prior to myself. We have an app for that. Your prescription ID card contains important information about your prescription benefit plan and a customer service number that you can call 24 hours a day, 7 days a week. You can easily create a digital profile at expressscripts.com or on the Express Scripts mobile app to gain access to your digital prescription ID card. You can also view your card online or on the app. You can download it to your digital wallet or even print a card from our site. Long-term medications are taken over a sustained period of time. So medications to treat things such as, or manage things such as high blood pressure or cholesterol. One important thing to note, change to your benefit, is that starting January 1st, you are able to get a 90-day supply of long-term medications, either by home delivery from the Express Scripts pharmacy, which is not a change. That's what you've been able to do and are continuing to be able to do, is use Express Scripts home delivery pharmacy. But starting January 1st, you have an option as well where you can visit one of the participating retail pharmacies to fill a 90-day supply. And those pharmacies include Costco, Rite Aid, and Sharp Breeze Steely. So while you're not required to move your long-term medications to a 90-day supply at a participating pharmacy, you will experience a savings in copayment in filling one 90-day supply versus 3 30-day supplies. The copay is the same whether you fill a 90-day supply at home delivery or at one of the participating retail pharmacies. If you choose home delivery from Express Scripts Pharmacy, your medications are delivered straight to your door with free standard shipping. You can transfer your prescriptions easily online, by phone, or through the Express Scripts mobile app to get started. You can also enroll in automatic refills. And of course, a reminder that you're able to get in touch with a pharmacist by calling the customer service number on the back of your ID card. Again, 24 hours a day, 7 days a week. So you're able to talk to a pharmacist from the privacy of your own home when you need to. So to get started, starting January 1st, you can log in or register at expressscripts.com/90day, or you can call the number on the back of your ID card, and they can help you with the next steps on either how to get started with home delivery or help you locate a nearby participating pharmacy. Accredo is a specialty pharmacy. It provides personalized patient care for members with a wide range of chronic complex health conditions. A specialty medication is a medication typically used to treat chronic complex conditions such as multiple sclerosis, cystic fibrosis, and cancer. Your Accredo team is here to make your path as smooth as possible and help you along the way. Accredo does that by having specialty clinicians as your guide. Our specialty trained pharmacists and nurses are available 24/7 again for any questions about your therapy. You'll also receive one-on-one clinical support to help you administer your medications safely and effectively. And your Accredo team helps you manage possible side effects. For certain conditions, Accredo nurses also can help you administer your medication in the comfort of your own home when appropriate. The route to getting your medication is also easy. As allowable by law, free shipping is there to where you choose, and when you choose, that is available to you. Medication is handled with care, including refrigeration if needed. And you can also order refills on Accredo's own website, accredo.com, or they also have an app as well. Accredo also, one last thing to mention about Accredo, with these special medications that can be quite costly. So Accredo is also able to help you navigate insurance coverage through your plan and any financial assistance that's available through the manufacturer. So I've kind of mentioned these here and there throughout the earlier slides. So you do have several resources available to you when it comes to your pharmacy benefit. The Express Scripts mobile app is one that I've mentioned, of course. It can be downloaded for free. Simply go to your mobile device's app store and search for Express Scripts. You can again create your digital profile there or at expressscripts.com. And once you're in one of those tools, you're able to again see that digital prescription ID card. You can use a price of medication tool there to help you search for lower cost medication options. You can search for in-network nearby pharmacies. You can move over to home delivery, enroll in automatic refills for home delivery, do order tracking with home delivery, look at your claims history, and so much more. So if you have any questions about any of those tools as well, you would reach out to your member services team. Again, that number on the back of your ID card, but that's your go-to, whether it be questions about your benefit that you are able to see on one of the digital tools perhaps, or they can get you in touch as well with a pharmacist. I think that rounds me up for today. So thank you for your time. I will go ahead and look at some of the questions that came through the chat here as well, but I'll be sticking around if anything else is needed.
Amy, thank you. Appreciate it so much. And thank you to all of our carrier partners. We're going to transition now. We're going to talk a little bit about out-of-area nationwide access. This is a question that comes up during open enrollment quite often is, if I have any dependent students that are going away to college, or if I'm planning to retire and possibly move to another state, what type of retiree options are available to you? So the way that it works, and this is for 2023 as it currently stands, that if you are planning to retire and you're looking to move out of the state of California and you are currently enrolled into the UnitedHealthcare HMO plans or the UMR PPO plan, then you would provide the county with the new address of the location that you're going to be residing in. And then basically what we will do is we will put you onto a nationwide PPO plan that will provide you guys with coverage so that you have access to, all the doctors and everything. So that's for your retirees. Now, this also applies to your out-of-area students who are going away to college. So if you are currently enrolled into one of the UnitedHealthcare HMO plans or the UMR PPO plan, and you have a dependent student who's residing, we'll just say in the state of Texas, then basically we can go ahead and put them on that same out-of-area coverage plan. It's a nationwide PPO plan through UMR. And so what will happen is you, the subscriber, will remain on the plan that you're on. So whether it's the HMO plan or the PPO plan, and at no additional cost, we'll go ahead and put your dependent on the nationwide PPO plan. And so basically there's no change in premium. The cost will remain the same. The only difference is the student will pay different out-of-pocket costs at the time of service. And that just depends on, the state that they're living in, how much the office visits are and everything like that. They'll remain on this plan until they either move back permanently home or they age out at the age of 26. So this is currently what we have in place for 2023. But what I am excited to announce is for 2024, so beginning on 1/1 of 2024, and this is going to be for your out-of-area dependent students only, is that we have gone ahead and partnered with Surus. Surus is a UnitedHealthcare company where really it allows for your dependent students to have digital access to a bunch of network providers. And so basically, they're going to have that same PPO that I just mentioned in the previous slide. So they're going to have the same access to the providers. However, what's going to be great through the Surus program is there's no longer going to be any deductibles or no co-insurance. So currently for 2023, you are subject to a deductible. You do have co-insurance at the time of service. But for 2024, that's going to change. Instead, there's going to be co-pays. So it'll be flat dollar amount. So basically more affordable care for your out-of-area dependent students. So again, as I mentioned, you would stay on the plan that you're currently subscribed into, and then your dependent student, once we are provided with the address of your dependent student, they'll automatically be enrolled into the SURIS program. And so the great thing about the SURIS program is it's a digital platform where the dependent students will be able to go ahead and look for providers in their area. They're going to get a new ID card, and then they'll be able to get access to the SURIS platform. And that's can come in the form of an app or through their smartphone or their device. And basically, the way I like to think of it is think of it kind of like if you were searching for restaurants on Yelp. You know, you put in an area, maybe you're looking for, let's just say, burger joints or something like that, then it's going to populate all the different burger joints around you. Well, SURIS is going to do the exact same thing. Basically, you can go ahead and put in whatever symptoms you have. Maybe you have the flu, maybe you have a cold, maybe you have sore throat, whatever it is. And that dependent student will be able to look for providers in their area. And so they will go ahead and search for a provider. They can see all the different providers in that area. What's great is they can go ahead and schedule an appointment through the SURIS app. And then also it's going to show what the out-of-pocket cost is for that service as well. So they'll be able to actually lock in that price. So for instance, if I need to go, if I see a couple different providers, maybe you see one doctor, it's a $20 copay, another doctor, it's a $30 copay. And so they will be able to have access while they're remaining in the state that they're residing in. If they ever move back permanently, they would go back onto the plan that you're currently enrolled into. But this does give you great coverage for your out-of-area dependent students who are going away to college. Now, whether you're enrolled into the UnitedHealthcare HMO plans or the UMR PPO plan, this automatically means that you're a VIBA member. And with being a VIBA member, you have access to additional benefits that are available to you and your covered dependents at no additional cost. So we're really excited to announce the first one that's going to begin in 2024 is access to KindBody. KindBody is what it is it's a fertility solution benefit. Right now, you do not have any coverage for any type of infertility services, meaning that if you were to seek fertility solutions, you, the member, would be not covered, and you would be responsible for 100% of the costs. And as you know, fertility treatments can be quite costly. I mean, they can range all the way up to $20,000 in out-of-pocket costs, and then even going into the procedures, they range all the way up into the tens of thousands of dollars. So we're really excited to announce that whether you're on the UMR plan or the UHC HMO plans, you will have access to KindBody, and you will have one full Kind cycle covered at 100%, sponsored by VIBA. I'm going to go a little bit into what the Kind cycle means, but really what type of concierge does KindBody offer? Well, they're really here to help you from beginning to end, whatever your fertility quest is. And so this could be anywhere from someone who is just wanting questions about fertility services, making any type of appointments, speaking to nurses about, how fertility works, things like that, to your preservers. That could be, freezing of sperm and eggs, and then just, planning for that family that you're, once you start to go through the fertility stages, all the way up to, new parents, so expecting mothers, basically also they're going to be with you through the entire live birth process. And then, of course, if there's any post-fertility that's needed as well, they can go ahead and assist you with that as well. So they really are a concierge service that does a lot of hand-holding all the way from beginning to end, where they will be able to provide you with services. They really will handhold you, I guess, as you would say, for your fertility benefit quest, and really be there for you the entire time. So where is KindBody located? So KindBody is actually located all over California, and we'll go ahead and make note into the San Diego County area. So the signature locations are highlighted in yellow right now. So right now they're currently building 2 new signature locations in the San Diego County area, and they're hoping to have this sometime in by the end of Q1 of 2024. And one of those, I believe, is going to be in La Jolla. I'm not too sure about the other, but we will go ahead and provide you with more information as we get their signature locations. However, they do partner with other different types of fertility centers in the San Diego County area. So these include Del Mar, Mission Valley, Camino Real, and then also their Reproductive Sciences Medical Center in San Diego. So if you are looking to grow your family and looking towards fertility solutions, we recommend that you contact Kindbody. If they need you to go in for a consultation, they're going to refer you to the nearest location that's available to you. Not only do they provide you with fertility solutions, they're also going to provide you with menopause support too. So, if you've ever been through menopause, that can be obviously quite difficult time and obviously no fun. So not only do they provide fertility solution support, they are also here for you if you're going through menopause. So they can provide you with access to nutritionists and therapists, health coaches, nurse practitioners, and they can really help you through your menopause journey. I mean, there's anything from, the lifestyle assessment to hormone testing, all the way through any kind of virtual visit follow-ups, prescription hormone therapy if it's needed, and much, much more. And so if you are going through menopause, feel free to reach out to Kindbody. They are more than happy to help support you through that process. So this talks a little bit about who is eligible for coverage. So if you're enrolled into the UnitedHealthcare HMO plans or the UMR PPO plan, then I mentioned that VIVA will sponsor one full kind cycle. So really, what is one full kind cycle? Well, think of it as basically they're there to help you through the entire process. So basically anything from the consultations to the artificial insemination, there's fertilization, the IUIs, and then, they're going to go through the entire live birth with you, and then any post-treatment follow-up. That is all going to be sponsored and covered by VIVA at 100%. So all you have to do is reach out to Kindbody, and they will go ahead and begin your journey. Now, if for whatever reason you need to use an additional kind cycle, so meaning you need to use it again, then you will be able to utilize this service. However, it will be at a discounted rate. So you'll see discounts on services of anywhere up to maybe 20%. So this is a really great benefit because, where you didn't have fertility solutions before, now this is going to be part of your plan moving forward. Now, for your members, for whether you're on the UMR PPO plan or the HMO plans, then basically Express Scripts has partnered with GoodRx through their Price Assure program to guarantee that you're going to get the lowest costing price on generic medications. We've all seen the commercials before where, folks are at the pharmacy, they're not able to afford the prescriptions, and then they go ahead and they promote GoodRx and they're able to get that prescription at the lowest cost. So basically what Express Scripts did was they did a collaboration with GoodRx through their Price Assure program that basically is going to show whenever you're going to pick up your generic medication, it's automatically going to be at the lowest cost copay. So whether that's the GoodRx price or if that's through the Express Scripts price, then either way, when you go to ring it up at the register, you're guaranteed the lowest cost price for your generic medications. And what's great is you don't even need to sign up for GoodRx. So this is a benefit moving in 2024. Also through Express Scripts, we want to let you know that there are waived medication copays for certain types of medications. These include hypertension, diabetes medication, or even your cholesterol medications. And this is going to be through their Smart 90 retail pharmacies. Amy had mentioned this before, that if you're taking any type of long-term drugs, then you have access to their long-term pharmacies. And so those are what are the long-term pharmacies, again, are going to be through Sharpry Steely's pharmacies, Costco and Rite Aid, and then also the home delivery system. So if you're taking any hypertension, diabetes medications, or high cholesterol medications, any of those generic prescriptions that you're taking on a regular basis will be at a $0 copay if you go through their Smart 90 program, which is their long-term pharmacies. Also through Express Scripts, you have access to their Save On SP program. This is for members that basically may need certain types of prescriptions if they have any type of chronic conditions, for example, like as Amy had mentioned, like cancer and more. And so If you're accessing any of these type of medications through Accredo, they can actually be quite costly. I mean, they can be anywhere from tens of thousands of dollars per prescription, all the way up into the six figures just for a prescription. And so what they did was they went ahead and partnered with Save on SP, where you can get those medications at a waived copay. So basically, it'll either be a $0 copay, or it might even be a very minimal copay, maybe between $5 to $15, depending on the prescription. But it's really simple. You basically, all those prescriptions will be filled by Accredo, their specialty pharmacy center. And then you would just sign up by going to saveonsp.com/Viva to get started. Flu shots. So each and every year, UnitedHealthcare is kind enough to sponsor flu shots for our VIBA members and the populations. And so this year, what we are doing is we have different locations, or what we are notifying you as health fairs, basically, where you can go ahead and get your flu shot administered at no additional cost. So there's different locations that are spread out all over Southern California. We have different dates. In fact, last week we had one at our VIBA 2 location, which is actually right down the street from the County of San Diego's main campus, but we are going to be spread out through all over Southern California and a lot of locations in the Southern California area. And so not only are we providing free flu shots at no cost, then basically you will have access to additional health screenings. This could be like cholesterol screenings and things like that, where you can get checked for different types of health screenings, and for you at no additional cost. So we have provided a informational flyer to the County of San Diego to disperse out. So if you are interested in coming out to one of the flu shot fair events, then please feel free to do so. It's at no cost to you. You can get your flu shot administered. Keep in mind, if you aren't able to make one of these health fair events, then you can always get your flu shot at no cost at one of the participating retail pharmacies. Now, I'm not going to go over this too much in detail, simply because Nick already had touched base on this. But as Nick had mentioned, there is chiropractic and acupuncture through Optum, and that's by going to that website, myoptumhealthphysicalhealthofcalifornia.com. I just want to remind folks that as long as you go to an in-network provider through Optum, and you do so by going to this website and using that promotion code California Schools VIBA, then you can go ahead and do a search for in-network providers for chiropractor and acupuncture services. As long as you do so, you have unlimited visits subject to medical necessity. And basically what's going to happen is your chiropractic or acupuncture copay will be aligned with whatever your primary care physician copay. So you can go ahead and see over to the right hand side that if you're on a HMO plan and your PCP copay is between $0 and $10, then every time you accessed the chiropractor or the acupuncturist, then you would have a $10 copay. And then so on and so forth for the $15 copay, the $20 copay, and $25 and up. You can see what your out-of-pocket copay will be for an acupuncturist or a chiropractor at that time of service. Again, I just want to make mention, you do need to go to find an in-network provider to myoptumhealthphysicalhealthofcalifornia.com, and you will use the access code California Schools VIBA. All right, now we're going to talk a little bit about our VIBA advocacy department. This is actually one of my favorite departments that I pretty much work with almost pretty much on a daily basis. And the advocacy department really is here to advocate for you, the members, to assist you with any questions that you may have. Navigating the healthcare system, a lot of times it can be quite difficult. You can't seem to get the answers that you want to get. Maybe you're being bounced around from phone tree to phone tree, trying to get answers to the questions. Well, that's where the advocacy department is here to assist you and get you the answers to those questions. So they're an in-house dedicated team. They're available Monday through Friday from 8 a.m. to 5 p.m. I've provided their contact information on the lower right-hand corner, where you can either email them or call them. And then basically they can assist you with things like access to care, quality of care. Maybe you're having a hard time getting a referral pushed through, or maybe you're having a hard time scheduling that appointment. They can assist you either through the carrier, through your medical group, or even through your doctor's office with whatever questions that you may have. Maybe you're getting a bill in the mail and you're not exactly sure why you've received that bill and you thought it was covered under your plan under, let's say, a certain copay. They can help get the answers to that as well. One example that I like to use that I've seen firsthand is I've actually had members standing in line at the pharmacy and they're trying to get their prescription, and the pharmacist is not able to pull up their information for whatever reason. And so they're being charged retail costs for that prescription. Well, I've had the member actually step out of line, contact our advocacy department. The advocacy department was then able to provide that member's information to the pharmacist, and then that member will be able to get their prescription at the appropriate copay. That's just one example of many things that they can help you with. But if you do have any questions, our advocacy department is here to help stand by. Also, if you're transitioning to a new provider, maybe you're thinking about switching plans this year, they can help you with that process. If there's any type of continuity of care, or you need to have your prescriptions move over, things like that, they can assist you with that as well. Now, Teladoc Medical Experts is a second opinion program. So this is a little bit from Teladoc, the virtual visits they have. This is another benefit that's available to you and your dependents at no additional cost. And really what Teladoc Medical Experts is a second opinion program. Maybe you've been diagnosed with a chronic condition, or maybe you need to have an aggressive surgery. And before undergoing treatment, then you want to get that second opinion. And so that's exactly what Teladoc Medical Experts is. So what you would do is you would either contact the number on the lower right-hand corner, or you can visit their website and basically schedule an appointment. They're going to have a consultation with you of whatever it is that you're going through and whatever type of treatment that you're about to have. And what they're going to do is, with your permission, they're going to work with you on getting access to your medical records. Feel free to share whatever medical records you feel comfortable sharing. That's completely up to you. But this could be anything from maybe the doctor's office visits, the consultations that you've had, the different treatment options. They could get access to, your lab work, your MRIs, or your X-rays. And what they're going to do is they're going to take that information and they're going to send it up to one of their 50,000 world-renowned doctors, and they're going to get you partnered with a doctor in the area of expertise of whatever type of treatment that is that you're seeking. And so I'll give you an example. Maybe I need to have a knee replacement. And so what they're going to do is they're going to take that information, they're going to send it up to one of their world-renowned knee doctors, and then I'm going to have a conversation with that doctor, and he's going to go over, if I'm getting the right diagnosis, the right prognosis, the right treatment options that are available to you. Maybe that surgery that you're about to have, that knee replacement, maybe it's an outdated surgery, or maybe surgery is not needed. Maybe there's an alternative form of treatment that hasn't been sought out. And they can even talk directly with your doctors as well. So at this point, it's one of those, it gives you that second peace of mind. So it's a program that I hope none of you ever have to use, but it's really great if you do need it. And so it gives you that second peace of mind. So whatever treatment option that you decide to move forward with, you'll feel confident knowing that you made the right decision. Not only do we want to care for you, but we want to care for your four-legged friends as well. So if you have any canines or felines, then basically Inside RX Pets is a way for you to get certain types of pet medications at a discount. You can see anywhere from up to 77% off generic medications, or 15% off any of your brand medications. It's really easy to get started. You just simply go to InsideRxPets.com. You're going to go ahead and register, and then you'll be able to print out an ID card. Once you get that ID card, you just can simply take it to one of the 40,000 different participating pharmacies, and you can go ahead and get those medications at a discounted rate. I have checked, and unfortunately, flea medication is not included in this. However, if your dog or cat is taking any certain types of medications, then it could be at a discounted rate for you. And so you can always visit and see the formulary on their website at InsideRxPets.com to see, if the prescription that your pet is taking is at a discounted rate. That's basically, it's just a way for you to go ahead and save prescriptions on those certain types of medications. Next, we're going to talk a little bit about Carum Health. So Carum Health is a premium surgery benefit for anybody who's planning hospitalization for spine procedures, orthopedics procedures, coronary artery bypass graft, or bariatric surgery. Now, this benefit is only available to members who are enrolled into the UMR PPO plan. So if you're enrolled into the UnitedHealthcare HMO plans, this does not apply to you. But if you are enrolled into the UMR PPO plan, then you do have access to Carum Health. And if you are planning hospitalization for one of these type of procedures, then we do encourage you to contact Carrum Health. And really what Carrum Health does is they go ahead and they take a look at the different hospitals, the different doctors, the types of lab equipment that's used, and they go ahead and they rate it based on, positive outcomes, the lowest amount of readmissions, and things like that for having that type of a surgery. So for example, I'll go ahead and use that knee replacement again. If I were to have that knee replacement and I contact Carrum Health, then basically they're going to let me know that, hey, Matt, what we know is that Hoag Hospital does a ton of knee replacements each and every year. They have the best doctors, the best surgeons for doing that knee replacement, and we have the lowest amount of readmissions. And so they would go ahead and let me know that. Now, if I choose to go through Carrum, then basically that surgery is going to be covered at 100%. So all your deductibles are waived, all your coinsurance is going to be waived. If there's any traveling up to the hospital or not, then that's going to go ahead and be waived as well. Or if there's any type of meals or overnight stays, things like that, everything is going to be covered at 100%. So if you go ahead and utilize Carrum Health for that type of surgery, then basically they will cover it at 100%. Now, if you decide, you listen to Carrum, you say, no, you know what, I want to use the doctor that I've been currently seeking, I want to use my specialist to do that surgery, that's perfectly fine as well. Basically, then at that point, you would just pay whatever your normal out-of-pocket cost for that surgery would be based on your benefit plan. Finally, we're going to wrap up here by talking about the VIBA Resource Center. So the VIBA Resource Center was opened up back in, I want to say, 2019, and we have two different brick and mortar buildings. We have one in Mission Valley on Hotel Circle South, and then we have one really close to the County of San Diego's main campus. It's right off Ruffin Road, so I want to say it's like 1 square block just below or just east of where the main campus is for the County of San Diego. And really what the VIBA Resource Center is, it's a place for folks to be able to go and work on whatever well-being challenges that you may have, whether it's physical, mental, social, or emotional. We're really here to assist you with whatever challenges that you may have and provide you with more of a holistic type approach towards your healthcare. And so the VIBA Resource Center, as I had mentioned, it opened way back in 2019. We have the two different locations, but really what do we offer at the VIBA Resource Center? So there's movement classes, there's stress management classes, there's cooking and nutrition, as well as personal and professional development. So if you are interested in going to the VIBA Resource Center, you can come stop by anytime. We can give you a tour of the facilities. You can plan any events over there. But what you would expect to see is that we do have, a full gym in there. So basically it has weights, it's got ellipticals, it's got Stairmasters, things like that, where you can utilize gym equipment. But then also there's counseling rooms. There's a healthy cooking kitchen in there where we do healthy cooking demos. And then we also have, different types of rooms, like we have massage chairs that you're available to. And then some of the classes that you would possibly see would be anything from like yoga, meditation. We have sound healing classes. There's different types of stress management classes. There's meditation. If you've ever wanted to try acupressure or acupuncture, then you can go ahead and do so as well. And then our most popular are our cooking and nutrition classes, where it's performed by our very own Chef Leslie. I don't know how she does it. She can tell me how to take broccoli and make it taste like bacon. It's absolutely phenomenal, the different types of healthy meals that she can whip up. So feel free to take part in as many of these classes as you want. You can stop by the VIBA Resource Center at any time, and we'll be happy to allow you to utilize the services there. Again, it's for you at no cost to you. Now, we understand that maybe going to the VIBA Resource Center on a daily basis, maybe a weekly basis, or even a monthly basis may be a bit challenging. We understand that, you have busy lives, you have to work. So we wanted to let you know that we have a lot of our content virtually as well. So we have actually 200 different monthly classes each and every month that you can take part in. They're 100% at no cost. You can pretty much share them with everybody. So you can go ahead and share them with your friends. You can share them with your family members. You can share them with your coworkers. You can share them with people you like. You can even share them with people you don't like if you want to. and go ahead and take part in as many of these virtual classes that are offered. The only thing that you wouldn't be able to do would be like acupuncture, acupressure. Obviously, you got to be there in person for those. But the yoga, the meditation classes, things like that, they're all available. And we record each of these classes as well. So if you miss a class, you can always go back and take a look at the class maybe that you had missed. As I mentioned, we have 2 different buildings that are available to you, one that's located really close to the County of San Diego's main campus. And so if you ever want to tour the facility, maybe there's a group of you, maybe you have a meeting that you have that you would like to have, you can have it at the VIBA Resource Center and go ahead and take part in the VIBA Resource Center activities. We can provide you with lunch, you can have your meeting and see all the different resources that are available to you. And then I'll touch base in a couple slides here about bringing the Resource Center out to you guys as well. Also through the VIBA Resource Center, you have access to our Care Navigation program. Our Care Navigation program is where you can get more one-on-one type treatment for whatever well-being challenges that you may have. They're going to work with you on a strategy that works and develops best for you, because as you know, healthcare is not one size fits all. What works for one person may not necessarily work for another person. And so we want to make sure that we are working with you as an individual and providing you with roads to recovery on whatever challenges that you may have in a holistic approach, and then also making sure that you have achievable goals so that you really can live your happiest and healthiest lives. And so you can simply go to our website. It's at vibaresourcecenter.com to go ahead and sign up for one of our care navigators. Finally, we also want to let you know that we are willing to bring the well-being resources out to your site location. So we partner with the County of San Diego. We're really grateful for that partnership where we can bring a lot of well-being resources out to your site locations. One of the examples of this was, I believe last week you guys had like an inflatable obstacle course that VIBA was there to assist with, as well as with the partnership of UnitedHealthcare. And so we're really happy to bring out these type of different well-being activities. It could be anything from yoga classes, healthy or like walking challenges, things like that. So if you are interested in being part of having any of your well-being resources, we do have a dedicated team to go out to your sites and provide any well-being activities that you would like to have requested. You simply go to vibaresourcecenter.com/wellbeing. And as I mentioned, we do have a partnership with the County of San Diego that we're really grateful for, where we can continue to bring a lot of well-being activities out to your site locations. And then just don't take it from us. We always want to promote the VRC, from word of mouth directly from our members. And so I'm not going to read each one of these testimonials, but we are here to assist with you living your happiest and healthiest lives possible. So we do have a lot of different testimonials from members where the VRC has been great for you. Great for those members that are accessing it on a continual basis. And so, if you haven't been to the VIBA Resource Center, please feel free, come out, try it, take a look at our website at vibaresourcecenter.com, and you can take a look and participate in all these activities at no cost to you. Finally, I just want to provide you with our contact information. I know there was a lot of information here, so you can always reach out to our advocacy department. That's at thevibaonline.com/contact, or you can call them as well. So this is any questions that you have about your benefits, about bills you've received, things like that, anything navigating the healthcare system. And then we have a lot of additional resources at vibaonline.com. So feel free to take a look whenever you get a chance. With that being said, I wanted to provide you with my contact information. Again, I am your dedicated account manager for the County of San Diego. My name is Matt Ogden. Please feel free to reach out to me with any questions that you may have. And then also Heather Simonson, who is our VIBA ombudsman. She's been with VIBA for some time now and is also happy to assist with any questions that you may have. With that being said, that does conclude our presentation. I would like to go ahead and at this time thank our carrier partners. So thank you, UnitedHealthcare, UMR, and Express Scripts for being here and presenting on your slides. We do appreciate it. And then I do want to give a great, want to go ahead and say thank you to the County of San Diego as well for allowing us to be here and present this information. So with that, with this conclusion of our presentation, we'd like to go ahead and open it up to any questions that you may have at this time. Nidra, did you happen to see any questions that may have come through that we can go ahead and answer?
Yes, we did have a few questions come through, and your colleagues, grateful that they were able to acknowledge and respond to those questions. But one I think that still may be unanswered, and I could be wrong, is what's the difference between an assigned medical group and a medical provider network? Excuse me.
Do we know if this was for the PPO plan offering or one of the HMO plans?
The question came in rather early, so I believe it pertains to the HMO.
Nick, is this something that you're able to answer? Was Nick
Hey,
still
sorry.
able to?
Yeah, I'm here.
Okay.
I'm here. Can you hear me?
Yes, we can hear you.
Okay. Do you mind repeating the question, Nidra? I'm sorry.
Oh, no worries, no worries. Let me go back up there. Let's see. The
I must have missed
question.
it.
No worries. We have a lot of great questions coming in and a lot of people managing the box, so we appreciate everyone's patience. Looks like, where did we go? I had it pinned and then, okay, getting there. So, Nick, what is the difference between an assigned medical group and a medical provider network?
Got it. So the networks that UnitedHealthcare offers are the Alliance, Harmony, and the PHMO Network One. Those are basically the plans that are available. Now, each plan or network has a listing of medical groups underneath them that can vary from network to network. And the medical groups are basically um, your primary care physicians belong to a specific medical group. So Sharp is a medical group, Scripps is a medical group, UCSD is a medical group. Those are the network of doctors for network of doctors, and those are what medical groups are. Our networks are basically what the medical groups fall under on the UHC side of things. So I hope that helps explain that.
Great, thank you, Nick. Another question, separate from the HMO inquiry. Are personal trainers available at the Resource Center?
Personal trainers. So we do have our care navigators, but yes, we do have personal trainers that are at the VIBA Resource Center that can assist you with utilizing some of the equipment and things like that. So we do have on-site staff that is there to assist you with utilizing any of the equipment that you would like to go ahead and access while you're there.
Okay, great. Questions come in that I can answer. Will this PowerPoint be available? And yes, we will be posting a copy of the recording on the benefits website. I would say give it till mid next week to anticipate when the posting will be available for you all. Okay, more questions are filtering in. For the Viva tongue-tied here. For the Viva Resource Center, would I be able to bring one guest for the in-person cooking classes?
Great question there. And the answer is, as long as they are a VIBA member, then they can go ahead and utilize those services. So basically, maybe you have a dependent that is under your plan, then you could go ahead and utilize that. For any of our in-person cooking demos, you do need to be a VIBA member. However, if you do want to participate in any of the virtual cooking classes that are available, then you can go ahead and share those with anybody.
Great, great. Another great question. Could you explain the out-of-pocket? I'm assuming they're referring to the PPO or probably the high deductible health plan for this question. Claudia, if you'd like to elaborate more in the chat, we'd be happy to answer that question for you. And
Well, Nidra, every plan actually has an out-of-pocket limit on them. So to answer the question, out-of-pocket limits are basically everything you pay for services received through your medical plan. So this includes your co-payments, any co-insurance on any of the plans. Anything you pay for services applies towards your out-of-pocket limit. Now, in the case of the Harmony plan, this will also include your copayments for your prescriptions. That will be applied to your out-of-pocket limit on the Harmony plan, as well as your deductible. But again, that's any medical service you pay a copayment for is applied to the out-of-pocket limit. And once you reach that out-of-pocket limit, meaning you satisfy the amount due, then you whatever your plan is that you're on will pick up all services, all covered services at 100%, meaning you will no longer have a copayment.
Keep in mind that's also for that given plan year as well. So we'll just say, let's use an example. Let's say the out-of-pocket limit is $3,200 for the high deductible plan. For that given plan year, if you utilize $3,200 worth of services at that point, then any additional services after would be covered 100% for that given plan year. And then into the next year, it would restart again.
Yeah. Another great question. Would we be able to reach out directly to Kindbody and schedule an appointment with them, or will we need to get a referral from a PCP?
Great question. No, you do not. You can go ahead and reach out to Kindbody for all of your questions. We will be providing you with informational flyers that you can reach out to Kindbody for. So more information to come from Kindbody. We're really excited about this benefit, but you do not need a referral. You can go ahead and reach out to Kindbody directly. However, if you are seeking infertility treatment or solutions at this time, then Kindbody can also assist with that as well. And really, they are a concierge type of service that can really handhold you through the whole thing. So more information to come with Kindbody, but you do not need a referral. And again, this service begins in 2024, so it's 1/1 of 2024.
Looks like a follow-up question to the Kindbody. It's pertaining to in vitro treatment. Does that cover one retrieval, one transfer, or would it also cover one transfer after multiple retrievals?
Ooh, that's a really great question. I don't have the answer to that. That's a really great question. That would be something I have to go back to Kindbody for. I know that Kindbody, if you do reach out to them, they will definitely be able to answer those type of questions with how many retrievals are included and things like that. So I don't have an exact answer to that right now at this time. However, we can go ahead and look into that. And then feel free to reach out to Kindbody as well. They already are aware that this is going to become effective 1/1 of 2024. So if you have any calls and you want to reach out to Kindbody, please feel free to do so and just let them know that, hey, Kindbody is included in our benefits. I am a VIBA member, and they'll go ahead and be able to assist you with those questions.
Great, thank you, Matt.
Of
We have
course.
another question regarding treatment offered through the urgent care facilities versus emergency, and it pertains to breathing. So what can UHC do for HMO services that used to be offered at a copay of $25 at urgent care versus paying ER copay of $125, as they do not offer breathing treatments at urgent care? So if I'm understanding this employee or even the member, any breathing treatment services have always had to be rendered through emergency care versus urgent care, and they're concerned about those copays.
So in that instance, what I would recommend is the member reaching out to their primary care physician. I completely agree. Having to go to the urgent care, every time is not an ideal situation. So the primary care physician should be able to refer them to another specialist or maybe a doctor's office that will be able to assist in those situations. So that would be my recommendation for them to reach out to, is their primary care physician.
Great, thanks, Nick. Another question pertaining to the HMO. Would a member be able to move between medical groups within the network during the plan year? So for example, they're with a Scripps doctor as a primary care physician, and then later they want to switch over to a UCSD primary care physician.
Absolutely. So as long as the medical group and primary care physician is within the network that they elect, they can absolutely make those changes throughout the year. Again, I do highly recommend they make that change before the 15th of the month, and understand that when making those changes, there will be new referrals that need to be put in place, and you'll have to kind of start from the beginning with your first primary care PCP appointment. But yes, they can absolutely make those changes throughout the year.
Right, another great question for HMO. Are in-home post-surgery care and medical transportation services available?
Great question. I medical transportation services in an emergency basis. I'd have to pull up the benefits specifically to verify, but I'm pretty sure those are covered. In-home post-surgery, are they referring to, oh, in-home post-surgery care?
Yeah, looks like post-surgery care. Yeah.
I'll have to verify. If you'd like, I can verify those benefits and possibly email you, Nidra, but I don't have that specific answer right in front of me.
Okay.
And that's
And
also just to add on, Nidra, too, that the member can always reach out to our VIVA advocacy department too to help get the answers to those type of questions as well.
excellent. Okay. And Matt, since you mentioned that, are you able to reshare the Viva advocacy contact information on that one
Yeah,
slide?
what I can do is I can go ahead and put it into their phone number into the chat feature here.
Okay.
And then I'll go ahead and share the screen too as well.
Okay. As Matt does that, I'll address a few more questions here. Is the kind body benefit included with the Harmony high deductible health plan?
Yes, whether you enroll in, no matter which HMO plan that you enroll into, either through UnitedHealthcare or the UMR PPO plan, then you do have access to kind body.
Okay. Another good point. Can HC send more information through social media, email, and postage as reminders? Sometimes it's hard to make these appointments. The gym resource is the best. Thank you for those who advocated for this. So I guess the main question is there a means of connecting and sending out reminders for the members?
Would this be talking about the VIPA Resource Center?
Yes, it sounds like that. Yes.
Oh, yeah, absolutely. So VIBA does have a newsletter, so you can always go onto our website at vibaresourcecenter.com. Sign up for our newsletter, so it's really easy. And basically, you can go ahead and register your email address, and it will provide you with updates on any new things that are pertaining to the VIBA Resource Center. It'll also give you a link to view our class schedule on a monthly basis as well. And feel free to take part in as much of that, many of those classes that you would like to do so. So yes, we do have our VIBA Resource Center newsletter that you can sign up for to give you the most up-to-date information pertaining to the Resource Center. Great question.
And I see that Matt did put the slide back up for the VIBA contact with their phone number and their QR code for those of you who are still on. I'd like to access that information and make a note of it. Thank you, Matt. I see you put it in the
Of
chat as
course.
well. Appreciate it very much. Well, looks like we have wrapped up all of our questions. For those of you who may have some lingering questions and we weren't able to get them answered today, or you think of something later, you can always reach out to the benefits division, as well as your departmental benefits ambassador, and also VIBA that Matt has posted on the screen here. We would like to say that this concludes our webinar. I thank Matt and his team for presenting. It's a lot of information. So thank you to all the employees who actually made time to also attend and take in all this information. We wish you all the best of the day and take care.
Thank you, everybody. Appreciate it. And thank you, Nidra.